The 3 Keys: How One Man Defied Diabetes with Vitamins. The rain was falling hard the night Edward Martin collapsed in his kitchen. It had been coming for months. The fatigue, the strange numbness in his feet, the dizzy spells that struck without warning. But Edward, 76, had always been stubborn. A retired machinist, a widower, a veteran. He wasn't the kind of man who asked for help. That night, alone, with thunder rumbling like a distant threat, he blacked out. It wasn't a stroke, not a heart attack. The paramedics, eyes grave, said just one word as they loaded him into the ambulance: diabetes. What followed was a blur. IV drips, finger pricks, a diagnosis confirmed: type 2 diabetes, advanced, and poorly managed. His A1C was sky high. Nerve damage had already begun. His balance was off, his mind foggy. "Mr. Martin," the doctor said gently, "if you want to stay independent, if you want to stay alive, something has to change." Edward nodded, but change at his age felt like climbing a mountain in the dark. Still, he wasn't ready to give up. The discovery. It was Claire, his youngest granddaughter, who gave him the spark. She was studying nutrition, smart, persistent, just like her mother. One Sunday afternoon, as she helped him sort his medications, she said, "Grandpa, you don't just need insulin, you need nutrients. There are 3 vitamins you should be taking. They could help more than you think." Edward raised an eyebrow. "Vitamins?" She nodded. Not gimmicks, not supplements from a magazine ad, real, clinically backed nutrients, 3 of them. He scoffed, but listened. And 3 weeks later, he wasn't scoffing anymore. 1. Vitamin D, the light inside the storm. Claire started with vitamin D. "You barely go outside. You haven't seen the sun in weeks. Grandpa, low vitamin D can mess with insulin. It makes your cells ignore it." Edward didn't believe her until the labs came back. His vitamin D levels were critically low, dangerously so. The doctors prescribed him 2,000 IU daily, and Claire made him sit on the porch every morning for 20 minutes, even when it was cold. Something changed. His energy, it returned, slowly but surely. The stiffness in his joints began to ease. His glucose readings, once like a broken roller coaster, began to even out. "Vitamin D isn't just a vitamin," Claire had said. "It's a hormone. It tells your body how to handle sugar." Edward started calling it his sunlight pill, and he never missed a dose. 2. Vitamin B12, the silent shield. 2 months into his new routine, Edward noticed something disturbing. A sharp tingling in his toes. Burning in his hands, like electricity snapping under his skin. At first, he thought it was age, or maybe the diabetes worsening, but Claire was already ahead of him. "How long have you been on metformin?" she asked. 4 years, he replied. She nodded grimly. "That's it. Metformin can drain your vitamin B12 levels. Without B12, your nerves begin to die." The blood tests confirmed it. His B12 was far below normal. He began supplementing, 1,000 micrograms a day, sublingual, under the tongue. Within weeks, the burning dulled, the tingling eased, his hands steadied. And for the first time in months, he felt like he was coming back to himself. He could hold a pen again, play solitaire without dropping the cards, feel the floor beneath his feet. It wasn't a miracle. It was B12. 3. Vitamin C, the unexpected ally. The final vitamin was the one he least expected: vitamin C. He always thought it was just for colds, something you took when sneezing started. But Claire showed him the research. "Grandpa, diabetics like you have higher oxidative stress. That means your cells are under attack by sugar, inflammation, and time. Vitamin C is your antioxidant shield." She explained how vitamin C helps lower fasting blood sugar, improves A1C, and protects small blood vessels. the kind diabetes loves to destroy. His eyes, his kidneys, his heart. He began taking 1,000 milligrams daily, in addition to eating more citrus and bell peppers. Within a month, the change was subtle but steady. His eyes didn't feel as tired, his gums stopped bleeding, and his morning glucose, once stubbornly high, dropped by nearly 20 points. Edward hadn't felt this good in 5 years. 3 months after his collapse, Edward returned to the doctor's office for a follow-up. His A1C had dropped from 9.2 to 6.8. He had lost 12 pounds. His blood pressure was down. His balance was steadier. His mind, once clouded, was clearer than it had been in years. The doctor was stunned. "What changed?" he asked. Edward smiled. "Claire," and 3 little letters, D, B, and C. Now, every morning, Edward takes his vitamins the same way he once took his coffee, with intention and a quiet kind of reverence. Not because they cured him, but because they helped him fight back. Vitamin D gave him light. Vitamin B12 gave him feeling. Vitamin C gave him strength. They didn't replace his medication. They did a message to others. Now Edward speaks at his local senior center, not as a doctor, not as a preacher, but as a man who almost lost everything and found 3 small tools that helped him build back a life. "You don't need magic, you need knowledge," he says. "Ask about your vitamins. Don't assume you're getting enough, because sometimes the thing that saves you is the thing you never thought to ask for." The final note. In a world obsessed with quick fixes, Edward learned something timeless. Real healing is quiet, incremental, intentional, and sometimes it starts not with a new drug, but with 3 forgotten vitamins: a little sunlight, a bottle with a red cap, and the voice of someone who believes in you. Because even in the shadows of diabetes, you can still choose to stand in the light.